Well, we know Sweden has very good healthcare. I think the quality of care is as good as anywhere in Europe. But the research suggests that there are areas which could be improved, and particularly engaging patients in their own care, giving patients good information and encouraging them to express their preferences, making care more personalised, and involving patients at every level of the system.
In my country, we've been doing quite a lot of work on this as well. We share very many of the problems that Elizabeth's just outlined that you face in Sweden. But I thought it might be helpful just to quickly go through the recommendations again and tell you how we're trying to tackle them and what we've learnt. First of all, patients' rights. We've had, in England, we've had a patients' charter for many, many years. What we found was that many patients had never heard of it, that many healthcare providers had never heard of it, that there was no follow-up and monitoring, and so it was basically ignored. But we've now got to the point where we realise that unless this is monitored right across the board, it still won't make any difference. And unless it's actively promoted, it still won't make any difference. Now, recommendation 2 was about shared decision-making. One of the things that we're trying to do, as well as trying to insist that care planning does happen in this way and is seen as a process, not a single event, is to give patients access to their own health records. Now, recommendation 3 was about collective engagement of citizens, of the public, as well as patients' organisations. And what we've learned is that unless you engage people in the tricky decisions that have to be made, for example, about closure of hospitals or mergers or changes of service reconfiguration, unless people are involved from the beginning and understand the reasons for this and indeed have an opportunity to express their views, then you can get into this kind of very oppositional scenario, which isn't particularly helpful for anybody. Recommendation 4 was about care coordination. Like you, we have problems with fragmentation of services, with problems at the boundary areas between health and social care, between secondary and primary care. What we're trying to do is to encourage people to see things through the patient's eyes as a starting point. National Voices got a number of its member organisations to just map out, they called it a web of care, map out how it is for a patient with a particular condition. Recommendation 5 was about establishing standards. In the last month or two, we've actually made some progress there in England. NICE has now been asked by the government to develop quality standards. So they've developed standards. The first 2 patient-focused standards are one on medical patients, and there's another one for psychiatric patients. Once you've got those, then you can move forward to tracking performance, which was the 6th recommendation. We've had a national patient survey program, mandatory, since 2002. Mandatory means that every hospital, every primary care facility, every mental health trust, every community health service is required by the government to do an annual survey and report. All this data is reported publicly.
A lot of the improvement has to come with an attitude change. People recognising that patients are experts in their own condition, in their own circumstances, and recognising that expertise and drawing it in. So, sharing treatment decisions, carefully monitoring patients' experience, and tracking improvements, tackling problems where you find them, but making sure that the standards are clear, that everybody understands them, and then checking that they're being complied with.